Hello and welcome to the first episode of Wellness Wednesday podcast with 3W Medical for Women, which is a nonprofit agency dedicated to providing evidence-based services in a respectful, caring environment. This is Beth Chase, and I am the host for this podcast, and I want to welcome you and thank you for joining us for our first podcast. Now, I have with me here today in the studio two very important staff members of 3W, and I'll introduce them now. The first one is Helen Wynn. She's the Executive Director of 3W, and we also have Dr. Susan Rutherford, who is the Medical Director of 3W Clinic. So let's start us out with Helen. Helen, can you tell us a little bit about yourself and why it is that, a little bit, I guess, about your background and why it is that you got involved with launching a program like this. And I do know that this is probably one of the first programs of its kind in Seattle. So why did you feel that it was important to get behind this kind of project?
Sure. Just a little background about myself. I'm born and raised in Seattle, and so Seattle has a really special place in my heart. I also have a social worker background here from the University of Washington. And so community-based, grassroots-based nonprofits are really important to me. When I was a student on campus, my friend and I felt that a resource like 3W really needed to exist, even though we have tons of hospitals and clinics around here. What makes 3W unique is how accessible it is to the community. It's also patient-centered versus provider-centered. And it's a place where you will really feel respected and give the dignity that you need as a person instead of providers profiting off of your healthcare decisions.
I know, Helen, that I've heard you say in the past how one of your motivations is that you wanted to make sure that women of all reproductive health ages, that they had a safe place to go to where they didn't feel rushed, where they could go and they could have an exam, meet with medical professionals without that pressure of feeling like the medical professional has their hand on the doorknob, needed to get out because of time constraints. And so I've heard you say that before, how important that was to you. And I also am aware of the fact that how big of a core value that is here. And you make sure that every patient, every woman who comes in here, it has the amount of time that they need to have to get their questions answered and to walk out with the fully informed on evidence-based information. So now I want to pick up, though, you also said that you wanted to make sure that women had a safe place to go to. Can you tell me a little bit more about why that motivated you so much?
Yeah, being a young person on campus, going to the doctors by yourself can be really intimidating. And I felt that when I did go to a medical provider that was, an on-campus resource for me, I didn't feel that I was very safe. The space that I was in was not in a room sometimes. It had a curtain. And so who knows who would be sitting out in the hallway when I was talking about medical issues that I was dealing with. So maybe a peer from my classroom was sitting out there. And the whole process was not centered around me. The questions were more like rushed, and I never felt like I got all my answers.
To the questions that you went in there for to get from
Yes.
that medical professional, right? Yes.
Yeah.
I think we've all been there. Absolutely. I think your listening audience is going to relate very much to that as well. Now, one thing you also said too is that not only should it be a safe place, but that a place where women can confidently understand that here at 3W know that they're not going to profit from the choices, the reproductive choices that woman makes. Can you share a little bit more about that?
Yeah, so all of our exams are free, and our lab fees are very, very low. Our pap smears are only $17.50, and that's unheard of here in the Seattle area. I know that going to anywhere else, you're going to be expected to provide a insurance card, a lot of documentation about yourself. We don't ask for any of that. And so it's very accessible. It's very easy to make an appointment. It's very easy to see any of our medical providers.
Mm-hmm. I love that.
Yeah, we try
Yeah,
to make it
uh-huh.
as easy as a process as possible.
Yeah, that's great. That's good. Okay, now Dr. Susan Rutherford. Dr. Susan Rutherford is really at the heart of this organization. She leads the way. She's not only the president of the organization, of the corporation, but she's also the medical director. And so, Dr. Rutherford, can you tell me a little bit about first, what's your professional background?
Well, I was sitting here thinking, actually, I'm in what you call the golden years of my career, and because I have a long history, and my background is being board certified in OBGYN and maternal fetal medicine. And for many years, fetal medicine, in other words, high-risk pregnancy, was the focus of my practice. But I also got involved in some academics and some hospital administration. And now what's really thrilling, to echo on what Helen said, was that at this time, it's really nice to not be pressured to see somebody and then have to do the documentation and then immediately move on to the next person, knowing that I'm always running behind and late. It's so wonderful to be able to complete conversations with patients. And I know most physicians feel very frustrated by the short times they're allowed for patient appointments. So doctors are just as upset about that as patients. This is really a lot of fun. And the volunteers that we've had come help us, we have somebody that comes about 1 day a week, for example. They really express the same. They say, this is so much fun because I really get to communicate with patients. So I got involved first as expecting to be on the board and sort of leadership and organize it. Then I realized that we really needed somebody who was going to be there a lot of the time. So I spend most of my time actually volunteering in the patient care area.
Well, okay, can you kind of share with us, Sue, the mission? How would you describe the mission of 3W?
Well, our stated mission, and it's on our website, is to respectfully provide compassionate, evidence-based sexual health services and education necessary to make informed healthcare decisions.
Okay, and what does that mean to you?
So it means that I get an opportunity as a physician to give the patient the resources and the background and the teaching that they need so that they can be in charge of deciding what they're going to do with their healthcare, what direction they're going to go. And we provide, for example, resources in the community because we're really kind of just a starting place. So we give them the tools so that when they go and pursue all the procedural things they might need to have done, or a whole lot of lab testing, anything that's really complicated, we are not set up to handle. But I can educate them about what that looks like so that when they go into those very rushed appointments, they know exactly what's on the agenda and they can respond and they can feel like they have some say in their healthcare.
Mm-hmm. I know you have talked with me before about your frustration with feeling bad that some patients, they come to you and they will say, share their experience that they've had with another physician. And your frustration with the fact that you understand having been in that position yourself, but you're concerned for that patient that indeed she now has a place with 3W to be able to slow down, get all of her questions answered, and then you provide resources, continued medical resources for patients after if there's something that you don't provide here at this clinic, right?
Correct. Well, I believe that once patients have the education about how the health system can work, about what they might be able to do in order to meet their needs, they'll have less fear about the healthcare environment in general. They won't be afraid when they go into medical offices. And once you've taken that fear away and they have some clue as to what's going on and the background perspective, then they're going to be much more effective at communicating with their doctor. Their doctor is also going to be thrilled that this person seems to understand what they're saying, and it's just going to make the whole process better. So I believe that a lot of people, they don't know much about their bodies, how their menstrual cycle works, what infections really mean. There's just so much very basic stuff that there isn't time to cover when they go into a regular doctor appointment. It's kind of background things, but that is where we can be a major assistance to them, which is getting them prepared to have some real responsibility in their own health.
Okay, so Dr. Rutherford, can you share with the listening audience about the services that you're currently providing and tell us about those?
Okay, so the most common one has turned out to be testing for sexually transmitted infections, STIs, STDs as they're called. Next, we're seeing a lot of women who have moved to the area or don't have a place to go, don't know where to go, find us on the internet, come in, get an initial consultation or appointment or maybe a pap smear, and then understand where they can go for their continuity care as they go forward. But I'd say also about a third or so of our patients total are related to pregnancy. Most often people, they may suspect they're pregnant, but they want to have that confirmed. They can do home pregnancy tests, although they're free if they come here, matching what they think their due date is. And that's where ultrasound comes in. We're the only place that people can come in without insurance, with no cost, no obligation, and come in and get that information. Am I truly pregnant? How far along am I? That allows them to take charge of their moving forward with other medical appointments. So that's a big deal. We also, will help support them with other resources. They may need insurance. How do they get insurance? There are lots of things. And that sort of case management approach isn't always easy to take place in a regular medical office.
Mm-hmm. What about birth control? What kind of services you have surrounding the reproductive birth control?
Yeah, so many women have questions about irregular bleeding or birth control that they're on or they'd like to be on or they're considering. And we take the same position. We're here to prepare people to get their medical care basically in other locations where they'll need to get continuity care, because we're not set up to be a whole huge medical institution where they can get all their services. But we can give them the education. We can give them the background. I've had women come in on birth control pills that are having some problems, and I go through what the components of that pill is, and I actually give them a list of other pills. What are the things that make these symptoms different? Maybe some people figure out, in fact, we have more and more women saying, I'm really not happy with being on hormones. What are my alternatives to that? So we discuss what the alternatives are in terms of watching over their fertility and their cycles, and are things normal? A normal menstrual cycle is a healthy thing. Menstrual cycles that aren't normal have some other health implications too, not just pregnancy or not pregnancy. So we basically do a lot of education, a lot of discussion, help them figure out what their concerns are and where they want to go.
Mm-hmm. So kind of what I'm hearing is that you equip women with evidence-based education, medical education, so that they can go out there and they can be better informed as far as talking to all of their other medical professionals, about their bodies, how their body works. Mm-hmm. Even I've heard you talk about before too, how you help women to know what kind of questions to ask.
Yes. I love giving advice to people about how you work the healthcare system, about, for instance, sometimes people feel like the doctor hasn't heard them or maybe was dismissive or something like that. So, nurses in the offices can be huge advocates for patients. So I'm a big fan of the nurses and the medical assistants that are working with the healthcare professionals, because for a patient, they're very approachable and the patient can say, help, I'm really having trouble communicating with my provider. What can I do? And so that's one tip I give out commonly, is make sure you talk to the staff too and ask for their assistance if your needs aren't being met.
So basically you're empowering women with questions and self-confidence, right?
Yes,
you're giving them the self-confidence
that's
to know what to ask.
True. I mean, empowerment is kind of an overused word right now, but that's truly what it is.
I know.
And confidence.
Okay, Helen, can you tell us a little bit about the core values in which all of these services are based upon?
Sure. We here at 3W, we believe that women are strong and capable of making their own decisions. Every woman should be equipped to make informed decisions about her own healthcare. No woman should be pressured into anything with which she feels uncomfortable. Women, regardless of their socioeconomic status, deserve healthcare that does not profit from their medical decisions, and every woman deserves to live in a safe and healthy environment. important.
Mm-hmm. And that's basically what I've heard here. Hearing is that it sounds like not only are these core values of your organization, but both of you, they're your own personal core values. And so you actually are living out your own personal core values in serving within a free, well, it's pretty much a free medical clinic, isn't it? I know there's some charges for lab fees and such. But can I ask you a question about
Yes.
that? Okay, fees. Are those fees lab fees only?
Yes,
Okay.
yes.
So, and they're at the cost of the lab fee itself, and there's no other.
Right, they're not
That's the-
charged, up-coded or
Okay.
anything like that. They're exactly what we have to pay
Okay.
the lab. The lab
Okay.
sends us a bill, we pay that. Even if a patient pays with a credit card, we eat the difference.
Okay.
But the reason we're able to do all of this is because we are donor supported. We have very generous people for whom we are deeply grateful to make it possible. And I wish that some of them could actually be a fly on the wall as patients thank us profusely over and over again for the services that they've had and the experience they've had here.
Yes, and I'm glad you brought up the donor aspect of this, Dr. Rutherford, because really you couldn't be doing what you're doing without these supporters in the community who really want to make sure they identify with your core values, but they want to make sure that there's no woman in Seattle that feels like she can't go and get quality care at either free or minimal charge.
yes.
And that even line up with her core values and not going to be rushed. They're going to be cared for. They're going to be respected no matter what, no matter what the choices are in that. So very excited about this organization, where it's going to go, where it's been. And they are now about almost 3 years old, aren't you?
Almost 2.
Almost two years
Yeah,
old.
well,
Okay.
Coming up May.
Yes.
Coming in May? Okay.
Yeah.
2 years old in May. Okay.
2
and-
continuous years.
2 continuous years. Yeah, they had a blip on the radar screen. We won't talk about that.
No.
But because
But
it's
we're
crazy.
we're continuing going strong
That's
right
right.
now. Yes.
That's right. So hope you enjoyed this
You want to know what we're going
podcast.
to talk about next time?
Well, yes. Tell me
'Cause
what
I-
we're going to yes, because
I'm
Sue's
really
doing
excited.
it. Okay.
Yeah. So we're going to talk about COVID-19 and pregnancy. You know, there have been questions about is it worse for pregnant women, or what does it mean? How about the baby? So we're going to talk about that.
Yes.
Which should be a lot of fun.
Should be a lot of fun and such an important topic. And I think there's a lot of confusion out there too. So I'm glad that you're going to give some evidence-based education about
Yes.
that. One thing we can always count on for Dr. Rutherford is a good education. So also I want to mention that if you can sign up for our monthly Wellness Wednesday e-blast at the 3wmedical.org website, that's the 3wmedical.org website, and just go to the top. On the top, there's a menu there, and click on the tab that says Wellness Wednesday, and get in on that page and sign up for that monthly e-blast for Wednesday Wellness. Would love to share with you some of the tidbits and maybe continued education, all kinds of things that we'll be doing in that short e-blast. Helen, thank you very much for being a part of this conversation today, and we'll be hearing from you soon. What's an upcoming episode that you will be doing here real soon?
I think I'm going to be discussing the UW produces a newspaper called The Daily, and there's a very popular edition in February that comes out called the Sex Edition. So I'm going to be focusing on that.
Focusing on the sex edition. All right. Don't want to miss those episodes for sure. Okay. Thank you for listening, and be well.